Thank you, and this is exactly what we hoped for. A powerful kickoff, a call to action, and I want to start in another area where we have a bond. It's very clear to me, that this is personal to both of us. You described as a young person how you felt the stigma, the hot scorn and cruelty. My brother struggled with schizophrenia for years. Not a night went by in the Wyden household when we went to bed not worried that he was going to hurt himself or hurt somebody else. And I felt right at the heart of what he was dealing with was the stigma. And he looked at me and he said, my brother plays basketball, look at me. He said, I'm sick. And it just really got me every single night. And these numbers, they just take your breath away. In early 2021, emergency department visits for suspected suicide attempts were 51% higher for adolescent girls. That's what I meant when I was concerned about the possibility of losing much of a generation. So tell us your assessment of where we are with respect to tackling, stigma, because it sure looks to me like the problem hasn't gotten better. And what you think, because you got the bipartisan leadership of the committee here, you got our attention on what to do about it. Your thoughts?
Well, thank you, Senator. I realize that one cannot legislate stigma away, yet it stands as one of the great challenges to us being able to address our mental health crisis. Stigma fundamentally, Senator, as you know, is about shame. It's about feeling ashamed of something we are going through. It's about feeling ashamed of who we are. And the challenge for people who are struggling with their mental health is they often come to believe that it's their fault, that it's reflective of a fundamental flaw they have. That sense of shame drives them further and further into a dark corner at this exact time where they need more human connection and support. There are things I think we can do as a country to address this stigma. I think number one, we can reach out to the children in our lives. We can open up a conversation about mental health and help them understand it is okay to struggle from time to time. That is human. It's what we all go through, and that it's okay to ask for help. The second thing we can do is we can share our stories with the people in our lives and with the public more broadly. One of the things I have been grateful to see is more athletes, more elected leaders, more community leaders stand up and share their own struggles with mental health. Every time that happens, it tells another young person that they aren't alone. And that is one of the great difficulties of struggling with mental health, is feeling that you are alone. But cultural change, ultimately, it takes all of us stepping up and recognizing the role we play in shaping how people talk about mental health and shaping the conversation around mental health. We need to be talking about it more, not less. We need to be addressing it not just in our families, but talking about it in the halls of Congress, as all of you have done, which I so appreciate. But that's how stigma changes. It's when people stand up, speak up, and choose to think differently about an issue like mental health.
We'll be certainly talking to you often about that in our work. I want to turn now to the question of parity. And for all of our families who had watched loved ones suffer, that day when Paul Wellstone, a liberal Democrat, and Pete Domenici, a conservative Republican, got the parity law passed, we felt like a big boulder had been lifted off our shoulders. We were going to get a fair shake for mental health in America. And so I have been doing oversight on these insurance companies for years. And I will tell you, I think the commitment to parity that's embedded in federal law is honored more in the breach than in the observance. And particularly during the pandemic, the insurance companies just seemed to find one excuse after another to not follow through and cover people. And families couldn't find providers who take insurance. There were all kinds of games about could you get somebody in network or out of the network, mountains and mountains of red tape. Because my time is out, we're going to talk to you obviously more about it. I'd be interested in your take with respect to this parity issue, because I think I mentioned to you my Oregon Health Sciences University, they couldn't get claims paid for months. I opened an investigation. All the claims got paid at once. That's not a system that the only way they'll pay claims is if their senator puts something in the newspaper. So give us your assessment of where we are on the parity issue, and particularly what you see with respect to compliance. And I know this is not a scientific judgment you can give, but where you think we are.
Well, Senator, I remember where I was when I learned about the 2008 parity law. I was practicing medicine at Brigham and Women's Hospital. I had seen the toll of mental health on my patients, and I knew how hard it was for people to get mental health care. And I was hopeful when that law passed that it would change that reality. I think the honest truth is that we still have a gap, that for many people, parity does not exist in terms of the coverage they get from mental health services versus traditional healthcare services. That is a travesty, and we have to close that gap. The Biden administration and the Department of Health and Human Services in particular have issued a report recently on these gaps that we currently face, where health insurance companies need to step up and reimburse adequately for mental health services. The administration is certainly expanding in a multi-agency way. It's the number of individuals to do the investigations. It's also moving to require insurers to provide proof that they are in fact meeting the parity requirements, and working to provide additional technical assistance to states so that they can also work to hold insurers accountable. This is going to be essential for access.
I'm over my time, and we're going to work with you on that as well. Senator Crapo.